You must be in a situation that you're thinking, man, the ICU, it is so hard. I feel like I should give up. Maybe this is not the right place for me. Maybe you just are a graduate nurse. You just started in the ICU, or you're from another area like L&D or pediatrics, and you're just transitioning into the ICU and you're feeling like overwhelmed. So in this video, we're going to talk all about that. So definitely keep watching. My name is Christine and welcome to a new video. If this is your first time here and you want to become a CRNA or grow your CRNA career, start now by subscribing and hitting the bell so you don't miss anything. So I still remember when I was in the ICU and I was a graduate ICU nurse. I started right in the ICU right after I graduated nursing school. I took my NCLEX exam, passed that, and I already had a job set up in New York. And I said to myself, wow, this is gonna be amazing. I'm gonna go right into the ICU. I remember when I did a externship/internship in New York City, and I was able to be in the ICU and see the surroundings, be a part of the environment. I saw that this was a great area to be in. However, now, having that mindset of being in the ICU as a student, now being in the ICU now as a graduate nurse, it was definitely another ball game. It definitely was different, and it was a different transition. However, I had the opportunity to be a part of a nurse residency program. I think we were one of the first cohorts at NYU Medical Center. So it was amazing to be a part of this. I felt like I had a bunch of other nurses who are graduate nurses who are going into, different areas in the hospital in nursing, as well as I had maybe 3 or 4 of us were going into the ICU. And the main thing with ICU, we were in the surgical, the medical, the critical care, cardiovascular. We all basically rotated around in different ICUs, which was great as a graduate nurse. But now, let's talk about the truth about how the experience was for me. So I still remember it was very stressful because yes, you graduated as an RN. When I graduated, I feel I didn't really have that clinical experience that I needed in general to be a nurse baseline. So definitely it was a lot to learn and grow. I remember I was very stressed. We also had didactics where we would have classes where we would learn about critical care medicine, a lot of the drugs, a lot of the nursing management skills that are required to be in the ICU, paired well with being in the ICU, being with my preceptor. And it was a lot. I mean, especially not having any background in nursing at all, just starting right in the ICU. So I can understand if you are a person who just got into the ICU, maybe you're a graduate nurse, maybe you're an L&D nurse, definitely comment below. I want to hear how your experience is, and maybe some tips and tricks that you've learned that helped you transition into the unit. So for our residency program, it was like a 6 months orientation with a preceptor and transition into night shift after 6 months, but we still had someone that we can go to if we needed help. Now, let's get started from the beginning. So when I was in the ICU, I had a preceptor in the beginning that we did not connect. It was a very difficult, learning relationship as well as communication. And I remember there were times where I was crying. Be honest, I have feelings, and I was crying. I really wanted to be in this area. I was frustrated. I felt like I wasn't growing. No matter what I did, it just wasn't right. And I felt that there was something wrong. Like, I did all the work. I went to all the lectures. I did my work behind. I tried my best. But it was a communication between me and my preceptor. No matter what I did, it just was not flowing well. To the extent that for me, I'm the type of person that I need to fix the situation. Not fix it 100%, but do something to make the situation better. So, of course, I went to my nurse manager and I told her what was going on, and I was very frustrated. We weren't connecting well. So my nurse manager, we had a meeting with my preceptor, and we went through the positives and negatives. And of course, there was, a lot to be said. But in my mind, I'm not leaving the ICU. I know this is the area I want to be in general. And so there's something that needs to change. So my nurse manager, I spoke to her and I'm like, hey, I have a different preceptor that I had when I was an intern and I was a student. I'd love to have that same preceptor to help me grow. I felt like when I was with that specific preceptor, even as a student, it was just amazing. Like, great communication. I mean, we were working well with each other. I felt like she was really teaching me, and I really was learning a lot. So then we had a meeting, and I met with my old preceptor when I was a student and transitioned to working with her. So then I was in the ICU, do my preceptorship with my new preceptor, the one I used when I was a student, when I did my internship. And that fixed the situation. It made it better. I mean, there's situations where things were difficult or things were challenging, but she was able to break it down. My specific preceptor that I had, my new preceptor that helped me out, she had years and years of experience. She was an expert. I mean, she would walk into the room and know what's going on. Like, she'll know exactly what to do from A to Z, and she knows how to teach well. So I was so excited, and from that moment on, because the first couple months, it was difficult for me. I was not growing. I was just communication wasn't there. Just wasn't a great learning environment for me with my first preceptor. But when I had my second preceptor, everything changed. Everything became better. Everything became solid. And sometimes you might be in a situation where you're with a preceptor, or you're in an environment, or you're in a specific area, and no matter what you're doing, it's just not working, and you're stressed. You feel like you want to pull your hair out because it's like it's not working. Thus, sometimes you need to change things around. Maybe change your preceptor. Maybe you need to change environments. Now, maybe not that specific critical care environment. I'm not telling you to leave the ICU. You need to give yourself some time, because when you're in the ICU, yes, you have this phase like, yes, I'm finally in the ICU. It's going to be great. But it's going to challenge you, but it's going to lay a foundation for you for your future. If you want to become a nurse practitioner, if you want to become a CRNA, if you want to be a clinical nurse specialist, if you want to be an educator, if you want to be a professor, the ICU is a great place to start. I mean, you'll get a well-rounded nursing skill set that can basically take you anywhere. So no matter what area you are planning to go into, the ICU is a great place to start. Of course, there's different types of ICUs, and I think whichever ICU is best for you, I feel is not, in my opinion, I don't think there's one ICU that's better than the other. I feel every ICU has its gives and takes, and I think that they have different principles that can allow you to be a very strong CRNA applicant, as well as if you want to go into another specific area. It's a great area to start no matter the area that you're going into. Because I know that you may see some forums, you may hear some people say, oh, cardiovascular ICU is the best, or the medical ICU is the best, or the surgical ICU may be the best. Honestly, the best ICU experience for you is what you make of it, because you can be in a cardiovascular ICU, you can be in a specific surgical ICU, any specific one, but if you're not making that experience the best for you, no matter what you do, it's not going to be a good experience. You have to make the initiative of making things like, for example, when I was my preceptor, we were on the same page, but my second one was amazing. So then we switched my preceptors, and I continued. I didn't give up, because there was a point where I said I wanted to give up. I was like, is this really for me? Not give up on leaving the ICU, but give up like, I'm just so frustrated. But when I changed my preceptor, and we were able to communicate, and I told her what my strengths and my weaknesses are, and she was able to help me. And she helped me grow, and that's what you want out of an experience. You want to be able to grow and get that foundation, because when you are outside of, when you leave your preceptorships and now you're on your own solely in the ICU working on your own, you want to feel confident. But just remember, even though, yes, now you've transitioned out of, having your precepts and now you're on your own, you still should feel comfortable on the unit you're in. It's all about the culture. You want to feel comfortable if you're in a situation that you have a question. If you have a situation where you feel uncomfortable about something, you should be able to ask a colleague, or ask your nurse manager, or ask the attending physician. Because at the end of the day, you want to learn and grow and become the best that you can be. Everyone's different, and everyone learns at different paces. So you cannot compare yourself to that next person over there or that person over here. You got to focus on you. and not compare yourself, because it's tough. You may say to yourself, oh my God, this person feels super confident. They're on another level than me. Well, that's fine. Let them be on that level by themselves. Let them grow. And that's awesome to look up on that person. Like, wow, that's great. They're doing great. But try to focus on you and how you can make yourself better. So now let's talk about some motivation, how to keep you positive, how to keep you going. So what I recommend is to keep up with the didactics. I'm also recommending that you really focus on understanding your drips, knowing, your medications, and understanding how to titrate those medications, and depending on what patient types are you going to use it under, what specific comorbidity, depending on the patient's history, as well as understanding your critical care management, understanding your pathophysiology, your normal physiology versus your pathophysiology, really understanding that. Also, yes, you're going to be with a preceptor and you're going to be in the ICU, but I do recommend when they have their daily, when the attending ICU doctor has the morning rounds, you need to be a part of that, because yes, you may have 1 or 2 patients in the ICU depending on how critically ill your patient is, or maybe 1 patient depending how sick they are. So spend that time when they do come around with a bunch of the residents, the interns, and all the different interdisciplinary team. Listen to what they're talking about. Listen to the plans, any changes in medications. They also talk about different pathophysiology, different type of conditions, and they'll go into detail about it. So you really understand your patients really well and kind of anticipate the plan for the rest of their stay. So definitely be a part of that. Will definitely help you as an ICU nurse as well as a graduate nurse. Yes, you might be in another area. So before that, maybe you were in labor and delivery, or you were in a medical surgical floor. Just remind yourself that you have had some experience. So yes, you may say to yourself, oh my God, this is so different. This is a totally different type of nursing. But yes, it is. And you can do it. You have to stay strong. You got to be diligent. You got to say to yourself, yes, this is a very uncomfortable, stressful learning curve for me, but I'm not going to give up, and I'm going to take it day by day and keep motivated and keep positive. Because think about your future. So saying, for example, you're a person who's saying to yourself, you know what, I want to become a nurse practitioner, or I want to become a CRNA. You have to have ICU experience in order to take that next step. So yes, your first month, 3 months, 6 months might be difficult, but as time progresses, it will become easier. Not easier meaning it's like, oh, it's a walk in the park. You're going to constantly keep growing, but it's going to allow you to lay that foundation to be a strong critical care nurse, which is important because you need to lay that foundation in order to become a CRNA, to be accepted into a program. So as a nurse practitioner, depending on the program, you can just graduate as an RN and go right into becoming, a nurse practitioner. Some programs don't even need any clinical experience. They just transition right into it. While becoming a CRNA, you need to have a minimum of a year of ICU experience. So you need to push through it. And I know it's uncomfortable. I also recommend is try to be a part of, go to a conference, a critical care conference. That can help. Also, start studying for your CCRN, which is a critical care certification, because that information will help you understand your patients, understand the medications. It'll help make you a strong critical care nurse, as well as be active on your unit. I mean, of course, when you first start on a unit, you're just first starting to become acclimated to the unit. You're a graduate nurse or you're a nurse from another area and you're just getting used to it. So maybe wait like 6 months. Wait till everything gets a little bit more comfortable. Don't give up. And then start being more active in different areas in your hospital. Be a part of committees. Be a part of the code team. Maybe try to transition to be a charge nurse. Also maybe think about research, what kind of things you can be a part of, as well as maybe be a part of extracurricular activities outside of the hospital to keep yourself positive, keep yourself in that mindset that will allow you to grow and be strong. So I hope this helped you. And if you want to learn more about CRNAs and how to grow your CRNA career, definitely click one of these videos over here, and I'll see you in the next video. Thank you for watching.